Non-Palpable Contraceptive Implant Removal. Part 1. Locating the implant. When a woman comes for removal of her implant, on rare occasions, you may not be able to find it. The implant may be under a layer of fat, or it may have been placed too deeply. This video will show how to locate a non-palpable contraceptive implant with ultrasound. Ask the woman where she believes the implant is located. Then, look for the insertion scar. Carefully palpate at that location. If you cannot feel the implant, next, palpate the triceps, located in the lower part of the upper arm. Then, palpate the middle of the arm where the groove between the biceps and triceps is located. Then, examine the entire upper arm. If the rod cannot be felt, proceed with ultrasound. Never try to remove an implant without locating it. If you cannot find the implant and ultrasound is not available, get an upper arm X-ray, providing the location and depth of the implant. To locate the implant by ultrasound, first choose your probe. It's best to use a linear probe. It provides very good resolution at a shallow depth, resulting in an optimal image. A vaginal probe can also provide a good image in some patients. If only a curvilinear probe is available, use a large amount of gel with light pressure to increase visibility of the implant. Now, locate the implant. Start by placing gel on the skin at the site of the insertion scar. Hold the probe lightly and perpendicular to the usual position of the implant. Then, adjust the frequency to the highest setting to get the clearest image. Move the probe very slowly back and forth. Here's what we're seeing on the screen. This is the fat layer. The white lines are fascia. This is the muscle. The markings here show the depth in centimeters. 1 centimeter, 2 centimeters, 3 centimeters. If you hold the probe parallel to the implant, the rod can be confused with fascia lines. To accurately identify the implant, hold the probe perpendicular and look for a dark linear shape. The dark line is the acoustic shadow of the rod as it blocks the sound waves of the ultrasound. Just above the dark linear shape is a white spot. This is the implant itself, located within the fat layer. If you don't see the dark linear shape, slowly broaden the area you're scanning. Once you've found the implant, reduce the depth to around 1 to 2 centimeters so that the shadow of the implant fills most of the screen. Then, adjust the gain to improve the contrast and see the image more distinctly. Now, mark the position of the implant with a waterproof marker. With the dark linear shape in view, slowly move the probe in one direction. Where the dark linear shape disappears, is one end of the implant. Mark that spot. Move the probe in the other direction until the dark linear shape disappears. Mark here at the other end of the rod. Next, measure the depth of the implant. The markings here show the depth in centimeters. Be sure to hold the probe lightly to avoid compressing the tissue. The implant is 1 centimeter below the skin surface. Compressing the tissue will make the implant appear more shallow than it actually is. For comparison, here is a correctly placed implant close to the skin surface. Here is an implant within a thick layer of fat. This implant is located below the fascia. This implant is located deep within a muscle. Here is a 2-rod implant. Next, use the color Doppler mode to check for any blood vessels near the rod. Vessels located more than 1 centimeter from the rod do not present a risk. Once you know the position and depth of the implant, proceed to remove it. However, if the implant is located within a centimeter of vessels or near the neurovascular bundle, or if you don't feel confident in your skills to remove a deep implant, refer the woman to a surgeon. Remember, the implant appears on ultrasound as a white spot with a dark linear shape below it. Mark the position and depth of the implant and check for nearby blood vessels.